From the name, persistent depressive disorder, it indicates chronic, less severe depression. Persistent, it lasts longer. And the key thing about persistent depressive disorder is the duration. The duration in adults is about 2 years, and in child adolescents, about 1 year. In major depressive disorder, the duration is 2 weeks, but the severity is quite high. So for persistent depressive disorder, symptoms are quite clear. All right, so there's subjective sadness. In child and adolescents, subjective sadness or irritability is observed by family, and they have 3 out of 8 symptoms that are listed in our criteria. And most of the listed symptoms will be reduced sleep or sleeping excessively, reduced appetite or eating excessively, low energy, poor concentration, or difficulty making decisions. They have feelings of hopelessness, and also they may have suicidal ideation. And these symptoms cannot be explained by using substances, and also it cannot be explained by other mental health conditions such as schizophrenia, schizoaffective disorder, or psychotic illness. Also, it impacts on their functioning, social and occupational and academically. The treatment of depression is not different from treatment of other mental health conditions. Our approach mainly is, one is educating, psychoeducation, educating the young person or the family about the condition, engaging them into talk therapy. The talk therapy has 2 main different approaches, but that's what we call cognitive behavioral therapy, which is one of the gold standards of treatment, and then interpersonal psychotherapy as well. Apart from the talk therapy, you have use of medications. Using medications, there are different types of medication that we use, because as I said, in the causes of depression, there's a lot of physiological and neurochemical changes in the brain. So these medications help. The approach will be the combination of the 2. And then it depends on the severity as well. If the symptoms are quite mild, you may respond well to talk therapy. And then some people that have been on the treatment in the past may not want medication. So that will make you focus more on talk therapy. There's another aspect of treatment, what we call behavioral activation. You want this person to be able to have daily structured activities. They have exercises and doing things that can help them apart from the talk therapy and the medication. But all in combination helps a young person to recover or feel better when they are depressed. Mental illness, at times the causes are not well established or not well known, but there are some factors that are implicated. So when there's a family history, that's what they call genetic factors. When there's a family history, the chances that one will have the illness is there. Also, there are some physiological changes in the brain that contribute to depression, and neurochemical changes as well. Also, life events, in childhood trauma, parental loss, separation, they all contribute to young person developing depression. Stigma in mental health is huge, and it impacts or impedes treatment. So it's very important that we work on reducing stigma. So you're able to speak up, and it's good to also document your experience in order to help other people around you. Then for the public, even like work environment or school environment, they should create a safe space for young person with mental health difficulties. And also support and accommodation, very important. Okay, and then we need to know our language, because you don't want someone that is struggling with depression to feel, oh, they think there's nothing wrong with me. They're trying to normalize the way I feel, but I'm actually going through torment. I'm being tormented by my illness. So education, creating awareness, offering support, advocating for people with mental illness is huge in trying to help to reduce stigma in our environment.